really like that. I think that's a really useful way to sort of put a closing parenthesis on that concept of patient agent hierarchy and asymmetry. And I really like this idea that there can be an imbalance, which is in fact amplified through forceful touch,
Yeah.
but that depending on willingness, you can then use touch and different type of touch to reduce the imbalance. And I think that there's something in there. There's something really interesting there because I think, we use it in our daily relationships as well, right? We'll use a more forceful handshake or a soothing
Yeah.
hand to the shoulder. We need to move away from this idea that touch is unitary in its form or its function. And I think you're giving a really good representation of the different forms and functions of touch within your practice. Are there any other kinds of, just to sort of see if I've missed any, but are there any other kinds of touch that you use? You've mentioned, healing touch. You've mentioned touch where you've had to have an intervention, like put a needle into someone. You've talked about forceful touch withhold aggression or to stabilize them. You've talked about soothing touch to calm them down. Are there any other types of touch that you can think of? Obviously, if you can't, it's also fine. But it's fascinating to hear about the different kinds of touch that you encounter.
Yeah, so I'm not 100% sure about the definition of healing touch. So I think if the definition kind of refers to the intention to heal someone or to improve something by touch, I'm not sure how much I use healing touch. So I definitely use more, I think, the social touch aspect, kind of just to foster human relationship, understanding. Sometimes, as kind of a touch might kind of give you more information than just the words can give you. Some people are not able to speak, so we have patients with catatonia, so they basically don't speak. So sometimes if you hold their hand or you kind of have their arm or something, that helps. So this is something words cannot achieve. We have a lot of people who are kind of delusional, yeah. So when you talk to them, whatever you talk, you're not sure if your what you try to say is actually perceived in the way. I'm actually fairly sure it's rarely perceived the way I want to do it. So I think it's a common problem in human anyway, the information transfer via language, but I think that problem is even amplified, especially in schizophrenia or also people who are intoxicated with drugs. So I think their touch is kind of a shortcut kind of to information. I think that's also something touch can be used, and that includes the kind of medical touch, which also gives you information. If someone is sweating or there's fever, you kind of touch the pulse or something. Yeah, but there's definitely also this kind of calming, soothing touch. I use especially more in elderly people, as I said before. Also use it like before the procedure. I think that's also something I use. But I think the healing touch per se, so really touching someone to heal, I would say I rarely use. I think you asked me, I think you sent me the list before, how is kind of healing touch perceived. And I still think for me the word sounds awfully esoteric, non-scientific, and I have to think more about this kind of German word Wunderheiler. So someone who is kind of basically performing magic, and I think that's kind of the connotation. Might be different in different cultural kind of backgrounds. I have a lot of people who are Muslims on my ward as well, and it already seems, not an expert on that, but it seems that their touch is also a little bit differently perceived, especially also among men, which is interesting. So I think there's way more touching, there's way more hugging, on the shoulder, this is common. So I think I use this quite a lot. And sometimes the patient initiates, but you still, have to be, I think it's still a thing you, as a doctor, because of the hierarchy there or the disbalance, you still have to be in control. Who's touching when? So even if the patient is touching me, sometimes I say, no, sorry, I feel uncomfy. I don't want you, to touch me, and vice versa as well. So I think again, it's I'm not even sure how to describe when the moments arise, I decide to touch, because very often it's not planned. It's not, it's more like it's a feeling. Yeah. So I would be interested in when, yeah, how do I decide when I touch, basically? So I think that's
I,
interesting.